At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Concussions, Sports Injuries, and Other Injuries on Wednesday, August 10th at 7 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
Attend Ageless Health 2016, maximizing the fountain of your youth. Live without pain and finally restore your physical capacity. Join radio personality and author Dr. Tom Roselle, DC and guest speakers at Ageless Health 2016 on Thursday, October 13th at the Angelica Film Center, Mosaic in Fairfax, Virginia. Learn why Ageless Health is the most effective way to create a lifelong healthcare plan that will change your life forever. For event details and early bird registration, call 703-698-7117 or visit agelesshealth2016.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any aspect of natural therapeutics that you have a question about. Perhaps you've had a problem, you've tried, you've applied, you've done the same old, and come up with the same old result, nothing. Well, here's an opportunity. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you on anything you've got in mind. So let's see if we can turn the light on the subject and make a difference for you. We do have a program, and one that we're going to, I think you're going to find very interesting. Interesting for a lot of reasons. One, the Olympics are here, right? We just started launching, and we've seen some accidents happen already. A French gymnast who snapped his leg. But we're going to talk about sports injuries compounded over a period of time. We're going to talk about injuries because we're all athletes. We're athletes in our home. We're athletes in our industry. But more importantly, summertime we get out and we want to do all kinds of things that we're unprepared for, and we never fix what was wrong before that. And then we're going to talk about, concussions and what the symptomatic presentation is. But here in studio and your host this Wednesday evening at 7 p.m. at the Roselle Center for Healing, none other than Dr. Scott Lamp. Hey, Scott.
Hey, how are you? Good afternoon, everybody out there.
It is. Hey, you got that right. It's first time. You usually say it's morning.
That's right. Yeah, we're on the other side of the spectrum there. So going to the PM.
I'm proud of you. Good job, man. So we're going to talk about the subject that you're going to lecture about this Wednesday, and basically athletic injuries that are compounded, but not elite athleticism. Things that happen to all of us with the things that we do, from accumulation of things that happen when we're golfing and we're playing tennis and, handball, or going out for a hard walk, or running, or whatever the things that we do. There's, we all like to do dancing, same type of thing.
Right.
We don't consider that an athletic event, but in fact it is. And then things that get much more serious, and we'll talk about that as the show goes on. But, Scott, let's talk about the cumulative effect of what people don't even think about when it comes to athletic performance. I mean, low level, Joe and Jane down the street just doing their own thing, and they put up with because they really don't think it's an issue. Take 2 aspirin and call me in the morning syndrome.
Yeah, I think we should get away from the site-specific type things. My ankle's been bothering me for 4 or 5 years. You got to look at the whole body, and that's the really, really big aspect of this thing. Number one is the accumulation of the injury to the site, and then secondly, what's going on in other parts of the body that might create that. For example, I might have an injury to my ankle. I sprained my ankle, so now it's not as stable. I start putting more pressure on my other leg, like my knee, and all of a sudden I start developing knee pain. We got to look globally when you look at athletes long term, and that actually makes things work a little bit better, and understanding that component. The other thing is also what happens to the body after you have multiple injuries the same spot. Things seem to get deeper and deeper into the tissues when you start doing that. You can take an example of somebody going through a whiplash with a car, for example. When you whiplash the first part, you got like primary movers, that muscles that kind of move the neck, and then all of a sudden they get affected. And then all of a sudden you have another whiplash in the same incidence, and then all the small muscles that hold the spine together get affected, and then the ligaments get affected. And it accumulates, and the more it accumulates, it's harder and harder to treat. So we've got forces on one area, but also looking at how that gets affected throughout the whole system. You got to look at the whole system with it.
The compensatory mechanism is one that is really amazing because the body can put up with all kinds of things.
Right.
And, you trace this back. Patient comes into the office and they're complaining about, my knee hurts or my shoulder hurts or my head hurts. And you ask them, well, have you ever had an injury? And they say no. And you said, sure. And we try to take it back 10, 15, 20 plus years, depending on their age. And then all of a sudden you come to, it shouldn't have anything to do with it, but when I was, and they come up with this event that took place, could have been swimming. They were in the old swim hole, or they were out running around as a kid, or, they hit themselves and fell down or they're out in a ski slope and they fell, or whatever it was.
Birth
process, absolutely. But we're talking about sports injury.
Yeah,
well, for some people, that's a sports injury.
No, for another day.
Yeah, for another day. Seriously, though, when it comes to injuries pattern, the body compensates. And you and I were talking about on the way up that, somebody has pain in one knee, and it's really compensation for the injury that took place on the other side. What's that all about, Scott?
Well, I think it's, I like to say it's something called a survival mechanism. We always want to get the job done. We always need to do certain things, and the body will try to get it done. And if it feels like the load on that particular area is not right, it'll compensate. And you don't even know it sometimes. I see this a lot also with people who are even working in front of the computers. They'll start adjusting their body, adjusting their head, and adjusting their arm because they're having a little bit of a twinge by using the mouse the wrong way. Same thing with sports. You start accommodating these positions, and the body will do it to a point. And the thing is like we have this unconscious mind that's saying, okay, well, let's shift this so we can get the job done. Until the point where it gets accumulated to a point where now it can't handle it anymore, and all of a sudden the pain starts shooting up. And like, why am I having pain after 10 years of doing this? So it's usually a survival mechanism. The body wants to do something. It adjusts to that, and all of a sudden it might be quick, it might be long term, then all of a sudden these pain patterns start showing up.
One of the most fascinating things that I saw some years ago, I treated quite extensively when they used to be the Bullets, now they're the Wizards, right, in town. And we treated several of their players. And this one guy came in, he was a forward, and he had sprained his ankle. And the ankle healed. I mean, the ligaments healed, the muscles healed, and so forth. But he kept having a re-injury. He would swell afterwards. And he came in, he went through all the therapy, they had the best of the best. And here's a compensation pattern that what was occurring is that not only that the ankle was injured, and meaning the ligaments and soft tissue and the cartilage and so forth, but also the multiple bones of the foot were no longer aligned properly.
Correct.
And subsequently, they didn't find that out, and he would continue, and he almost had to stop playing. And what we found with him was a very small misalignment of one of the bones of the foot, took care of that, and then everything started to heal properly. And we see that in many areas of sports injury and compensation patterns with low-level sports activity over a period of many years.
I think it's a conversion of energy, too. I mean, it's like if you take something, one of the problems we have is shoes themselves. I mean, you got things that a lot of times when you strike with your foot when you're running, for example, the toes are designed to splay out. They're not in shoes doing that. They're actually held together. And so what happens sometimes is that sometimes the energy is placed in other places. That's where you get sometimes this barefoot running. It's not necessarily good for everybody, but that might be something where it talks about dispersion of that energy. If that joint gets pushed into another place, where's that energy going? And a lot of the problems we have are like overuses. Like, okay, I'll keep running on something, and all of a sudden I keep on putting impact into a joint. There's compensation, all of a sudden bones shift, and that energy can't get out of there. And what I'm talking about, it's kind of like imagine jumping off from a small fence or a chair and landing with your legs stiff. Then that energy gets stored inside you. When you have those kind of things, it gets disruptive, it gets irritating, it breaks things, it causes ruptures of tendons or ligaments and those kind of things. So we don't want that kind of thing to happen. We want the body to be fluid and moving. But to do that, you got to think of the whole body, not just single individual parts.
I had a woman come in about 3 weeks ago, and she's a dancer. And she goes up to, the different dance halls in the area. She loves to dance, and she's out there literally 3 days a week.
Right.
Particularly in the summertime, they have some of these open air venues. And she said, I'm going to have to give up dancing, and it was breaking her heart. And she's telling me through the consultation, and I said, what's the problem? And she said, anytime I go dancing anymore, my legs start cramping up, and my knees hurt and they swell. And I said, so what are you wearing for shoes? Mm-hmm. And she came back with, I wear these moderate heels. I said, do me a favor, bring them in. So she brings them in the next visit, and here she's with these 4 or 5 inch heels, right? And I said, really, tell me that you're not dancing on those things. And she said, yeah, these are my favorite shoes. I said, that's why you have the problem, because it's throwing her whole mechanical pattern off. There are dance shoes that are not like that. Fashion is a killer. Well, we used to say, as long as the shoe industry continues to produce those kind of heels for women, we continue to donate their retirement fund.
That's right.
I mean, they're going to be in our office on a day-to-day basis. But Scott, let's get back to talking about, the cumulative effect of these type of injuries. Some people get out, they're not supported. We talked about the shoe, the box where the foot hits in the anterior portion of the foot, the pedal base, is supposed to be wide.
Right. And
so many of these shoes are narrow. So runners go out and their foots are cramping. They're causing the muscles to not compensate the way they're supposed to. The perpetual plantar flexion extension of the foot is thrown off, and we have these ongoing injuries that continue to accumulate.
Well, think about also muscular imbalances that happen here a little bit too, because sometimes when you raise a heel, something else has to shorten, something has to lengthen. What's the opposite muscles doing over a period of time? And those can actually be thrown off to some extent too. So you've got those elements that play a part also. Claw toes and hammer toes is usually a difference between one muscle pulling stronger on one side versus another, probably brought on by, again, the advent of shoes or not using your toes the way you're supposed to.
Well, it can go all the way up too, because, you have in the lower portion of the leg from the knee down, you got 2 bones and long bones, and that outside bone, the fibula head, houses a nerve that comes down and facilitates a lot of the muscles that go into that foot. And if that fibula head has gone to the outside, has just overstretched its holding area, then that nerve, that perineal nerve, is going to be compressed, stretched, irritated, and the muscles are going to misfire.
And the muscles react to it.
And that's where you get the arches dropping, they splay, they drop down, and you have a problem that nobody seems to be able to resolve.
So what you're talking about, again, is it's multifactorial, the different things that happen when we're looking at things, and be able to have somebody be able to look at that kind of thing. Differences in muscles, differences in where the joints positions are. What is the Q angle? They talk about this angle of the hip relationship to the femur itself. It's like if that leg is in a right angle, or is it too much of an angle? Do you put much stress on your knee? And the other thing we haven't talked about was we talked about things with applied kinesiology, secondary things that might have an influence on those aspects. And we talk about the 5 factors. You've always talked about quite a bit on those kind of elements. Are we even looking at those sometimes in relationship to it? And I'll give an example. I had a child that was from a foreign country, was adopted, knee problem, gymnastics, very high on the list, 8 out of 10 on the level that she was at. And one of the problems that she had was we kind of fixed everything up, but then we found out there was a little bit of a problem when she had emotionally, because she wasn't accepted because she looked different, and her step cousins didn't like her too much and literally almost tried to throw her off something that could almost have killed her. It was an emotional relationship, and also she had problems with her gallbladder. And we got her better from an 8 to maybe a 2. As soon as we adjusted or took care of that kind of situation, the gallbladder and her emotional element, which is in Chinese medicine tied to that, she 100% better, sleeping better, no problem with the knee. So we also got indirect things that also play a part.
Right now, we have people sitting out there saying, what's gallbladder got to do with any of this? We're going to tell you about that when we come back, because it's an important concept. We're talking about organ muscle patterns as they feed back to the nervous system, and that's, as they say, is a subject for a different story. Having said that, we're coming up to a break. In studio, Dr. Scott Lamp, your host, your presenter at the Roselle Center for Healing this Wednesday evening, the 10th, 7 p.m. Love to have you as our guest. All you need to do is call 703-698-7117 to register, 703-698-7117. Don't go away. We'll be right back. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle live in studio, waiting to take your phone calls. Love to talk to you on anything you have in mind. Call us. 888-630-9625. That's 888-630-9625. Let's put the fire out for you because you've been struggling. In studio, my guest, your host this Wednesday evening, the 10th of the month, 7 p.m. at the Roselle Center for Healing, Dr. Scott Lamp. We're talking about athletic injury, and as we get into the second part of the program, we're going to talk about concussions and what that really means. And sometimes you get a concussed situation where you don't even realize it's happening. There's the thing called spontaneous concussions. We'll talk about that as we go through as well. But for right now, we wanted to answer anything that you have in mind, but more importantly, we want to get through this paradigm of compensation, what happens with minor situations, minor injuries over a period of time, things that are unrelated. Dr. Scott mentioned that you can have relationships within the body that have to do with the internal environment that can weaken the outside. And that's what we've talked about repetitively over the years, is that the muscle system on the outside has connections to the inside of the body by way of the nervous system. So your thigh muscle, for example, that moves your hip and moves your knee, is not just your thigh muscle related to the nervous system, but it's your thigh muscle also related to the internal environment of the body, and that's your intestinal system, your digestive function. So you can have a muscle that weakens that does that. Before we get into it, I want to remind all of my friends that have been listening, particularly in the Gaithersburg area, that in a couple of weeks, I'm going to come out and visit you. It's going to be on Thursday night, the 18th, and we're going to be at the Hyatt up there. We'll give you more and more information. We'll talk about it extensively next week. So kind of circle that on your calendar, and remember that it's a very informal presentation, kind of like a community event, and we're going to have some fun with it. It's the second part of a program that I did a few weeks back, or a month or so back now. I don't remember how long it is. Time passes when we're having fun. But 3 keys to Ageless Health, and we're going to be talking about that. So coming up in the fall is our Ageless Health annual seminar, and this is kind of the prelude to that. So we'll be up in your area on the 18th. Dr. Scott, let's talk a little bit about, injury and how it occurs. People have this fight-flight reaction, and they get tense, and they want to attack the tiger. They want to go out there, and they want to beat that ball. They want to chase that thing or knock it down or whatever it is, right? And the jaws clench, and they get tightened up, and all of a sudden, for no reason at all, they didn't hurt themselves, but now they got pain.
Right.
Let's talk about that a little bit.
Well, I think going back to how everything interrelates, I think when we're trying to do survival, the key mode in survival is, can I find my escape routes and run away? And if my head is not right on top of and centered on my pelvis, my chin's not lined up with the bottom part of my pelvis, it's very hard for me to run away. Think about trying to run with your head lying to the side or cocked to the side. Kind of hard to do that. And so we find that if you've got a lot of jaw pain or some problems, you also sometimes, I find, and I don't know how many times you find in the office, Tom, that a lot of times when I find a hip problem, I always check the jaw. And the reason being is the body wants to keep the pelvis underneath the head so it can actually kind of run away. It's kind of like a fight or flight response. I need to be able to get away. But if that jaw's locking up, or that hip's locking up, and I can find, there's a couple times where I have somebody come in with a hip problem, I release the jaw, the jaw to actually open up a little bit better, their hip pain goes away. The
interesting study that was done years ago by the guy that started our specialty in applied kinesiology, Dr. George Goodhart, he put people on treadmill, and he
put, see that one.
Be nice guy. And they put a thermistor on the TMJ, on the jaw, and they put another one on the hip, and they watched it on a screen, and when the jaws jaw fires, so did the hip muscles.
Right.
And they went in synchrony, in opposition to each other. So if one was injured, the other one would be injured as well. So that's why we've talked about the TMJ. But here's a situation that's specifically attributed to stress patterns due to sports production.
Right.
You see guys that, they're lifting a weight, or they're trying to put out everything they can, and they tighten up their jaw. Well, what they're doing is they're causing the hips also to misfire.
Right.
And now they got hip pain or back pain.
Right. And also, I think some of the things, too, is also not just from the fact of doing the sport, but also being frustrated by the sport. And also, if they're sleeping, having patterns that way, too, that jaw can play a major, major aspect in regards to how well their body works, especially the lower back and lower section of the body. It's also interesting to see how many nerve fibers that the brain recruits for the jaw versus the leg. It's almost 10 times. So there's a lot of things the jaw does, and it's almost like this gyroscope that wants to stay on top, and there's constantly trying to maintain that. And I think, again, it goes down to really simple aspect. How do I survive? How do I run away? I need to keep my head on top of my pelvis. I'm going to correct that, or the body's going to correct that with us not even knowing it. And all of a sudden we start having some of these weird compensation problems.
If the structural system off, nothing is going to work, and it's triggered by so many different things, including stress. We've got a couple of minutes, and in the next half of the program, we're going to get into concussions, and we're going to tie all this stuff together. But before we do that, we want to get to the phones, 888-630-9625. Chuck, how can I help you? Thank you for holding.
Yes, my father is 95 years old, and he has COPD, and on one of his toes, he has an ulcer. It's not infected. They did a sonogram of his legs and showed the circulation is poor, and the doctor wants to do a angiogram, inserting a probe through the groin and with a balloon to open up the artery. And I'm wondering, at his age, is it a little risky for that? And also, I had spoke to a cardiologist who told me that if they do the procedure, make sure they do not use iodine contrast because it could harm the kidneys.
That's correct. What you have to do is find out what your father's GFR rate is, glomerular filtration rate, and if it's minimized, they can't use that type of thing. They're using a dye, and then they use a camera. And so the angiogram, by definition, is that. Can it be a risk for your father? Yes, it can, absolutely. I would get a couple opinions. It would depend on your father's state of health to begin with. It would be depending on how bad the chronic obstructive pulmonary disease, the COPD, is. It would be dependent on a lot of those things and whether he's a risk for any type of intervention. There's things that can be done to support and help him. I'm not sure that I can give you any advice, but I would tell you that you need to have at least a couple thought processes on this. If it was, my father, my grandfather, whatever, we would look at it a little differently because so much can be done from a natural point of view. Chuck, I wish I could get into this more specifically, but if you want some more data from me, just go to our website, go to rosellecare.com, ROSELLE. CARE.com, and send me a note, and I will respond to you. But I would be very cautious, and I would get a couple recommendations, not something I would just jump into unless it's life-threatening. We'll be right back after these messages.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live in studio. Call us, 888-630-9625. 888-630-9625. In studio, my guest, your host this Wednesday evening, the 10th, 7 p.m., Dr. Scott Lamp. He's going to be talking to you on athletic injury and concussions. And you know what? Here's the deal. You don't have to be a real Olympic athlete, participating in the World Games to have injury patterns. All of us that do little things, they're cumulative because we put up with them. We don't think they're a big deal. I'm a little too sore. We're unprepared for it. We compensate. And pretty soon the structure begins to break down and we come up with these pains that, basically we call our doc and he says, take 2 aspirin, don't worry about it, it'll go away. But then over a period of time, things begin to get worse and we forget about that small injury. We forget about the strain that we weren't prepared for. We forget about the fall and bumping our head that we didn't think was of consequence of any sort. And now, subsequently, we hurt or we can't move or we have limitations and we're afraid to do whatever and we chalk it off as, well, what do you expect for your age?
Yeah, we're aging.
We're aging. It's not aging, Scott.
Yeah. Definitely not aging. And I think one of the things is that we always kind of use you're getting old. Well, I think if somebody's telling you that, then they're missing the boat, at least on a lot of different things we just already talked about.
And that's the truth. And it's, we're talking about injuries that can have an impact. Let's talk a little bit. I want to get back into the injury accumulation, and I know you're going to talk about that in depth this Wednesday evening. And the thing of it is that any kind of athletic performance has the potential of injury if you're not prepared, and then we put up with it. We're too tight, and then we go, we take something to try to make it go away, or we limit our motion, our function. But the other piece is that we start getting, blows and traumas, to our system, and we don't know why we start with the headaches. We don't know why we have the disorientation. We don't know why we have the attention deficit problems that we never had before. We don't know why our vision is disturbed. We don't know why we have the numbness and the tingling, because I didn't do anything. And not only that, but emotional instability.
Right.
That's all, and it's a chronic concussive syndrome that takes place. And as we said, there's spontaneous concussions. You sit there on the sofa, and all of a sudden your head drops forward, and you're banging your brain.
Right. That's right. Because your brain is, it's kind of like tofu. It's really the consistency of that, and it's actually in this floating medium of fluid in the skull. And you got to think about it. It's kind of like if I have a apple floating in a container and I'm just shaking it, it's banging on the sides of that apple will start bruising on the sides. So it's it's not a very rigid type thing. And you think about how the body's set up. It's an amazing system. You've got a skull. How many organs have bone wrapped around it? Even the nervous system with the spinal column going down it that needs to protect it. And I think the body's got an innate intelligence about itself to kind of protect itself. And so you have this wrapping around, and even there's a blood-brain barrier, too, that goes around the brain also that keeps certain things out. So this is a very, very fragile piece that's so important that the body needs to have all this armament around it.
Concussion by definition is a bleed.
Right.
The brain is bleeding, and it gets swollen, and it has pressure on it.
Right.
And sometimes we don't even notice that there's, from the outside, because we don't have a bruise or injury. Head was a little sore for, a short period of time, but now we have this disability, if you will, or this impairment now that continues to occur over time. And so when you're looking, as you said, you have the brain, this cheese-like thing with all these ridges and grooves and things that are there, and it sits there, and this is the computer system, the brain. Without that, or the body, without that, nothing works. And then you have this water called the spinal fluid, and that's around that. And then you have this hard,
tough
mother sheath, right? It's saran wrap, and that attaches to the skull, and then you got the skull. And you have that to protect all this, but people get dehydrated, and they don't drink enough water. And that spinal fluid now becomes less than what it should. So injury now becomes predisposed, and so little things happen and big things occur.
Right. And I think the other thing is it's kind of interesting with the body. You go back to the reflex again with the head over top of the pelvis and trying to be in line. The skull does move a little bit. A little torquing move. It goes with respiration. It moves. The plates move and kind of move slightly. There's debate about how much, but there is some movement there, and so does your pelvis, but it doesn't move a lot. And it's interesting is that when the body has distortions, what's the most flexible place between the skull and the pelvis? It's the spinal cord. It's actually the spine will kind of buckle to kind of meet that distortion. Compensation. There's the compensation again.
Dramatic compensation in some cases.
But also with this pumping that you're talking about, because you need fluids moving, that fluid works like a water balloon around with something inside of it and uses it as a protectant to some extent. But what happens when we have a concussion and we lock one of those joints, lock one of those plates in the skull? You got 22 plates in your skull and it locks. And all of a sudden I can't pump or make or push as much of that cerebral spinal fluid that helps as a buffering agent. Doesn't work as well. And people are not really looking at that.
And you increase the pressure in that spinal fluid.
So now I got pressure pushing on my brain. Could that make a headache? Possibly. Could that make dizziness? Possibly. Can it give me brain fog? Possibly. Could it irritate parts of the brain that have been associated with different personalities? Yes. So I think it's an interesting thing when we're looking at concussions. What are we doing for the full examination of that? We got to look at those plates and the whole relationship between from that pelvis all the way up to the skull and how everything are moving in regards to that, because there's a lot of compensation there that can cost us dearly in our movement and our abilities.
It's a system that has to work exactly, and if anything is altered, it has to be compensated for someplace in the body.
Right.
And, we have soft blows. We used to think it was just boxers in the ring. We used to think that it was football players getting hit. Now we know that's the worst concussive injuries come from soccer players. They're using that head to smash that ball around. But in addition to that, we have the mild things that take place. We talked about the TMJ, the jaw.
Yeah.
So you tighten that up, that's going to affect those skull bones and the synchrony of the motion.
And I've seen you do this a couple of times.
Be a nice guy.
But when you go down, you bend over, and all of a sudden you smack your head on something.
Well, when you don't have enough hair on the top of your head, right? It's like a cat. You don't know where you're at, right? So
I can see you with a beehive. I can really see that.
Just, you're not far behind me. I'm just saying. Okay. But that's the truth. You get your head, you knock it, you're doing whatever you're doing with it, and, it causes a problem.
Right.
And I'm not going to go any further with you.
That's as far as you need to. But again, it's all those kind of elements that play a part. What kind of past history is what I've been doing? Do I have some whiplash injuries from motor vehicle accidents? It's a cumulative type thing to all of a sudden one day something starts, you add on, all of a sudden something starts to happen. And the other problem with concussions is that once you've had one, you're 4 times likely to have another. And the likelihood of that being worse than the first one is greatly increased.
And here's a cause of concussive problems that a lot of people don't even think about. It's kind of, out of the bounds, but we see it all the time. People who go out and run, or they're doing something that is compressive to the spine.
Right.
It's not just the spine that's being compressed, it's the brain's bouncing around in that skull as well. And if your skull's locked up to begin with, guess what you got? You got a bleed, you got a concussion.
Yeah, well, I don't know how many times I fell ice skating and fell on the tip of my buttocks, and all that pain, all that energy goes right up to the skull, and it hits like a log jam.
That's your problem, huh?
Boom, that's right.
You never told me about that. Every time I treat you, you forgot to mention that. Now I understand. 888-630-9625. That's 888-630-9625. Love to take your calls on any subject. We're talking about concussions. We're talking about injuries. We're talking about things that accumulate over a period of time. This Wednesday evening, Dr. Scott Lamp will be your host, your presenter at the Roselle Center for Healing in Fairfax. We're right off the National Capital Beltway on Route 50, literally about a third of a mile, in the Red Cross building. We'd love to have you as a guest. The sun is still up and bright this time of the year, so if you got a problem, if you know you do, whether it's you, your children, or you suspect that all of a sudden you're not functioning on all orders the way you used to, this is an opportunity really to find out, is there something that's happened, and more importantly, what you can do to fix it, because it can be resolved, it can be turned around. Call the office, call the Roselle Center for Healing at 703-698-7117. That's 703-698-7117. Tell the staff that you'd like to attend. Remember, seating is limited. We only have so many spaces, and when they're filled, they're done. We need a reservation. This is our gift to you to the community. All these in-house continuing education programs are for you because we want to educate you. We want you to have the knowledge. We want you to have the ability to really ask the right questions about your health. So give us a call, 703-698-7117, and register for Dr. Lamp's presentation this Wednesday evening.
Yeah, and we're going to be going over actually doing demonstrations. There's a lot of things you can help demonstrate, and some of the things we've talked about, and see that. And I'll pull maybe some volunteers up from the audience a little bit and kind of go through some of these things and talk about how they affect and how you can actually, a healthy person, just by putting something in their shoe, can throw their whole system off by just like, Tom, you were talking about being on the treadmill. Doing the same thing. I can put something underneath the ball of the foot and change how that information reads from the feet all the way up to the brain.
When I was a kid, I think I had bunk beds, and I was climbing up the bunk bed, and my mother told me to get off of it, and she left the room, and I climbed up the bunk bed again. I got on the ladder, right? The ladder wasn't attached, and I was pushing and pulling, and the guardrail was on the floor. And I came down and I smacked my head and laid it open, and it was, don't go there, Scott. I can see the look on your face, right? And
that explains it.
So, but the truth of it is that for a short period of time, my parents noticed that things weren't like they should be. Quite right. And it took a while, and after that there was a learning pattern that was altered. And it wasn't until many years later that because I compensated, I knew how to compensate, and I was able to fully take care of it many, many, many years later. But those are the things that happen. They happen early with our children. Yeah. They're playing balls, they're running into each other, they're knocking each other, they fall, they hit their head, and they build up over time. Same thing with adults. We do the same thing with ourselves.
And the thing is like when you hit, the brain itself, if you're in a calm state, it's like taking 30% of your energy. When you get into an injury for the brain, it's going to take a lot more energy. It's kind of like having a battery, but now it's only working half as strong, and you're going to expect to do everything you're supposed to be doing as you were doing before that. You're not going to be able to do that. So there's a lot of things. That's why there's a lot of restrictions on certain things that you do, and you got to prioritize and do those kind of aspects and not put a lot of stress on the system and let the body heal. Nervous system is not very forgiving sometimes, and you've got to be able to take it with it's an important element. You got to treat it like gold.
Well, here's the thing, and you just touched on it. The nervous system remembers.
Right.
Consciously, we're not sure anymore. We forget about things. We adapt. We develop other pathways. But when there is an injury pattern, that neurological system records it.
Right.
And it's there. And until it's released completely, it comes back and it causes an impairment that continues to show up in different ways and different manners. And it's so insidious, so slight, so slow, we really don't get what it is. 888-630-9625. That's how you reach us here. And this Wednesday evening, Dr. Scott Lamp will be presenting this information on sports injury, but concussive problems. And remember, when we're talking about sports injury, we're talking about athletes in the home as well as athletes outside the home. Things that happen to you all around. And we don't understand it. We say it's athletic performance, but you are an athlete in every endeavor that you do throughout your life.
For 8 hours sitting, you got to be doing an hour's worth of exercise because you're not making any circulation happening in your body if you're just sitting there and staring at a computer screen.
No, and you end up with injurious patterns. Your back is misaligned, your body posture is misaligned.
Don't get anything fed. There's no fluid movement.
Right. Spinal fluid is being depleted dramatically.
Right.
So we don't realize that these things are taking place, but they do, and they compound other things that may have happened over a period of years. And so when we say, it's nothing, it's no big deal, I'll be fine, it's not an incident that we can kind of look the other way at. We really have to be careful and protect our bodies. These things are resolvable, but we have to have the tools to do it.
Yeah, I think it comes down to, again, survival. I keep on talking about the survival mechanism, but I think one of the things that happens is that first you're in a normal condition, second you irritate that situation, then you get swelling, and then you get pain, or then you have maybe, some type of problem that happens, and then you have pain. And the body goes in that kind of realm. It doesn't immediately go, oh my God, I can't do this. It'll try to do it and try to get, and if you keep on pushing and pushing, and all of a sudden I get swelling that stays around now, it doesn't go away, and then all of a sudden eventually you get a pain situation. It doesn't mean things aren't happening to you that lead up to that event. So I think the thing is understanding that you should be listening. Anytime you start hearing something from the body, it's a wake-up call.
We know the incidents, and because we can point to it, of significant neurological impairment due to trauma. Guys like, the late Muhammad Ali, right?
Right.
He took a beating, and a lot of the guys in the rings do, and they lose their cognitive patterns, and they end up with Parkinson's, they end up with other types of things. It's that cumulative trauma without allowing it to heal properly that causes and then all of a sudden the degenerative conditions that we see, non-specific neurological degenerative states.
Then you got the nervous system involved in that. You've got also, and again, if you're not allowing the body to actually be expandable and move and free up, and the scar tissue locks things in, then you keep on hammering that spot. It is not free to let that energy flow. And I think that plays a part, and that'll affect your nervous system. It'll affect the ligaments. It'll affect the muscles, everything.
I'm going to bring up something that is an unfortunate situation. There was a woman, this goes back several years ago, that came into the practice. Unfortunately, I've seen many more of them before and after that. But I remember her specifically because she was a wonderful lady, very bright, but she was in a very abusive relationship, and she was taking trauma. And she ended up with MS. And her head was smashed into the staircase by her then boyfriend. And she ended up with an MS progression that went from 4 to 5 lesions and already began to demyelinate up to 26 lesions in 2 months. And it was directly related to the fact that she had been beaten. And fortunately, she was able to get away from that. We were able to help her. We were able to do a lot of things, but it took time, and we resolved it, and we were able to get that turned around. We're coming up to a break. You're listening to Dr. Tom Roselle Live. Dr. Scott Lamp, my guest, your host this Wednesday evening We'll be right back after some very important messages. Don't go away.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. We've been in studio bringing you the most important information that you can assimilate and put to good use for you, your family, and the people that you love. Why? Because we care about you. We want you to have the data. We want you to have the information. And we do that every Sunday right here at high noon on the Eastern Seaboard. Those of you on the West Coast that are listening to us, do the math, -3. Mid-country, those of you who are overseas that listen to us in our Armed Forces Radio that have been tuning in, thank you very much. Tell your friends about the program, and we will continue to be here and bring you the truth about your health and what you can do about it. This Wednesday evening, Dr. Scott Lamp will be your host, your presenter at the Roselle Center for Healing. He's going to be talking about injuries that have accumulated, athletic injuries. You know, if you have a child, you yourself, if you like to work out, if you do things even on a mild level, if you're an athlete in your own home, you're doing all kinds of things around. Those are athletic injuries. They're cumulative, and your body pays a price for ignorance and ignoring them. This is an opportunity to fix that and turn it around. All you have to do is call 703-698-7117. That's 703-698-7117.
This is a class that's good for coaches, it's good for parents, good for the athlete. So it's actually, and if you're somebody who's even an office worker, it's a good class for that.
Listen, you know, if you're dealing with kids, you're dealing with sports, you're dealing with anybody that is active, this is an opportunity, particularly if you've had any of the symptoms we talk about relative to concussion. It's important that you find out that you can do something about that. Want to go to the phones. Ann, how can I help you? Thank you for holding.
Hi. I want to ask you about how do you diagnose a concussion in a hurry without x-rays and all that?
Well, there's a couple things. There's actually a new thing they're talking about that when the body gets concussed, there is a protein that's released. Now they're looking at a blood test that's for that. But there's different things we look in protocols that we take a look at. One of the things I particularly like doing is you do balance tests, you do cognitive tests on the body. And the other thing that you can also do is what I'd like to do is actually have somebody read. And it's a higher level function of the brain. You have basically you have to look at symbols, and then you have to also interpret those symbols and see what happens in the relationship. We do a applied kinesiological test that's on that. I'd also like to try to have you read backwards because that same type of reaction is going to be harder to do that because now you're going against what you normally would think you would do, and you would actually be able to test some things like that. There's a lot of different small tests that we can do to make that work.
And you check if it's an immediate situation, and you're going to check the eyes because the pupils aren't going to react normally. You're going to look for bleeds within the eye grounds themselves. Reactive patterns relative to the eyes being able to follow direction, all those things are cumulative.
Blood pressure aspect, heart rate aspects will change in regards to those. So you'll have some things in the what I call the autonomic nervous system that will actually be things. That's what Tom's talking about with the eyes and stuff of that nature.
I hope that helps, Ann. We're coming up, short to the end of the program. I want to get Dr. Lamp to talk about the program this Wednesday evening, 7 p.m. at the Roselle Center for Healing. You're all welcome to attend. Dr. Scott, walk us through what you're going to do.
Well, we're going to talk about, we're going to show reactive patterns in some of the things and some of the testing that we do, so you actually see that. We'll give you some insights on some nutritional aspects you should be looking at when you do have a problem with a let's say possible concussion. We'll talk about some of the basic things like sprains and strains and what you should be doing for those kind of things, but also how to kind of look beyond just the aspect of the local side of the injury, where other things and musculoskeletal type things you should take a look at. And so there's a lot of information like that. We're going to talk a lot about the eyes and how you can. I'll do some tests on the eyes and show some things that you can do for that, and also some cognitive type things that need to be done, especially if you're a pre or post concussion victim.
It's important that you understand that injuries accumulate.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.